JoAnne take us away on Medicare Physicals, please?
Okay. All right. The question is, I would like to know more about coding a Medicare annual and subsequent visit comparing to a regular physical, which we all know Medicare does not cover. They cover one welcome to Medicare physical and then start with the annual and subsequent visits. This is probably the most confusing set of coding that I have found physicians to experience. For some reason, when Medicare developed these procedure codes, they just assumed that this was going to be a comprehensive physical checkup, and it's not at all. It's mostly record keeping and making lists of the patient's the history and whatever. And when you bill for these codes, we have a number of them. One of them is the Welcome to Medicare, which you would begin with at the time you turn 65, and you have a year to see the doctor, and they would bill a Welcome to Medicare. And you don't need a V70.0 as an annual physical exam. It is not necessary. Any diagnosis will do. And like I said, it's only from when you're Medicare eligible for the first 12 months. And then when you have the year has passed, you go to what's called an annual wellness visit, and that's a G0438. That's the initial annual wellness visit. Now, what I would recommend to people that do any billing and coding, go onto the Medicare website and get the status of where your patients are at, because a lot of doctors will bill for the Welcome to Medicare when a year has already passed, or a patient may have already seen another doctor, and so you would have to jump to the next level of the G0438. It's 12 months after the Welcome to Medicare visit, and it is not physical exam. The 99387 and 99397 are completely different, and they are not paid for by Medicare. These are definitely wellness visits where they record a lot of the patient history, and they're monitoring their health and focusing on preventive care. After the G0438, the initial, then from that point on, once a year, you would have the subsequent annual exam. Now, Medicare says that you can go to about 11 months and see the doctor. Let me tell you, I don't know what your contractors are like in your part of the country, but I say 12 months, 1 day, because it's really, you have enough appeals to deal with on a daily basis. To fight Medicare for 1 month, I just say wait the full year and go with it. But again, any of these visits can be billed with a sick visit. And again, if you went in for your annual wellness exam and you had a sore throat or an earache, you could also bill like a level 2 or 3 depending, and you would add the modifier 25 to the E&M code. So you can bill a sick visit with the wellness visit. And also on the G0402, just to tell you that there is also an initial EKG, and there are 3 procedure codes defining 3 different types of EKGs. And that is only the one time you can use this code, and it's only with the G0402. But just to add, if the patient, say that when they're having their vitals checked or whatever, because they do have a little bit of a checkup, the patient has palpitations or whatever, you are allowed to bill a regular EKG and link it to a diagnosis code for medical necessity. In addition to these 3 codes, the G0402, G0438, and G0439, you can also bill a Pap and a pelvic exam with these if that was part of the exam. And again, that's all relative to the visit. But what I wanted to point out is that the criteria for each one of these is very different. On the Welcome to Medicare visit, the doctor or provider reviews the beneficiary's medical and social history. They review the potential risk factors for depression and mood disorders. They review the functional ability and level of safety. The examination is the height, the weight, blood pressure, visual acuity, body mass index, and other factors that are deemed appropriate. That's the exam. The rest of it is all verbal and discussion. They talk about end-of-life planning. There's education and counseling involved, and referrals based on the prior components I just mentioned. And that's if a patient had problems or whatever. If you go onto Medicare website, you can see a whole list of preventive visits, from colonoscopies, bone density, mammograms, and that could all be part of the referral process for preventive services. That's covered in G0402. And again, if this was already provided by someone, you're going to get denied. So take the extra step and check on the Medicare website, verify the eligibility, and see which one of these the patient has already used.
Do you need more medical certification training? Go to www.cco.us. And don't forget to subscribe to our YouTube channel for updates.